Hello everyone, I am a professional esthetician and cosmetologist. Today, I will guide you completely about procedure, effects, costs, care and advice for exosomes therapy for hair loss. So subscribe my channel first and watch complete video to get best advice for your beauty. Hair loss affects millions worldwide, leading to a booming industry of treatments ranging from medications to surgical interventions. Among the latest breakthroughs in regenerative medicine is exosome therapy, a cutting-edge approach that promises to revolutionize hair restoration. Let's dive in. Section 1. What are exosomes? Exosomes are tiny extracellular vesicles, 30 to 150 nanometers in size, released by cells to facilitate cell-to-cell communication. They carry proteins, lipids, RNA, and growth factors, acting as biological messengers that regulate tissue repair, immune responses, and regeneration. Sources of exosomes include, number 1, mesenchymal stem cells, MSCs. These are the most common source. Derived from bone marrow, adipose tissue, or umbilical cord. Number 2, dermal papilla cells. These are found in hair follicles. These exosomes may directly stimulate hair growth. And third one is platelet-rich plasma, PRP, as some clinics combine PRP with exosomes for enhanced effects 12 times. Initially dismissed as cellular waste, exosomes are now recognized for their therapeutic potential in dermatology, neurology, and hair restoration. Section 2. How exosome therapy works for hair loss. Exosomes promote hair growth through multiple pathways. 1. By stimulating dormant follicles, they activate hair follicle stem cells and shift follicles from the resting phase to the growth phase. 2. By enhancing blood supply, they trigger new blood vessel formation, improving nutrient delivery to follicles, thus producing new hair growth. 3. By reducing inflammation, chronic scalp inflammation, e.g., in alopecia areata, can be mitigated by exosomes for anti-inflammatory signaling for hair growth. And last one is boosting collagen and keratin production. Exosomes boost collagen and elastin production, essential for stronger, thicker hair shafts. Delivery methods of exosomes into skin are, by microneedling patches, method of creating microchannels for deeper exosome penetration through microneedles. Or intradermal injections, directly administered into the scalp, similar to PRP. Or topical solutions, which are less common due to limited absorption, but some clinics combine them with laser therapy. Section 3. Pre-care and treatment process. Before treatment, discontinue blood thinners, under medical supervision. Avoid alcohol and smoking to optimize healing. Begin a regimen of hair-supporting nutrients, biotin, zinc, vitamin D. Some clinics recommend low-level laser therapy, LLT, to prime follicles. Treatment process. Step 1. The provider will cleanse your scalp. Step 2. Topical numbing cream will be applied, 30 to 45 minutes, on scalp to minimize discomfort. Step 3. Using sterile, single-use cartridges, 0.5 to 1.5 mm depth, are taken. Step 4. 1 to 2 milliliters solution of exosomes is massaged into microchannels of scalp. For post-treatment soothing, cooling mask and LED therapy is applied on client scalp to reduce redness and giving a feeling of cool and comfort. The entire process takes about 90 minutes, with minimal discomfort. Most patients describe it as similar to a mild sunburn sensation during microneedling. Section 4. Aftercare and results timeline. For first 24 hours, do not wash hair to allow exosomes to absorb fully. Avoid touching or scratching scalp, as it will increase risk of infection or disrupting treatment. Sleep on your back. Use a clean silk pillowcase to minimize irritation. No sweating, swimming, or heat exposure. Saunas, steam rooms, and workouts can wait. Days 2 to 7. Gentle cleansing only. Use a sulfate-free, pH-balanced shampoo. First wash should be lukewarm, not hot. Avoid direct sun exposure. Wear a loose hat if going outside. Skip hair products, no gels, sprays, or styling tools until day 7. Apply prescribed serums. If given a post-treatment growth booster, use as directed. Week 2 to 4. Expect some shedding, normal as weak hairs shed before new growth begins. Resume light exercise, but avoid excessive sweating for 2 weeks. No chemical treatments, coloring, perms, or keratin treatments should wait 4 weeks. month 1 to 3, monitor progress. Initial baby hairs may start appearing around week 6. Stay consistent with supplements, biotin, collagen, and vitamins support results. Schedule follow-ups. Some clinics recommend a second session at 6 to 8 weeks. For long-term maintenance, 3+ months. Consider touch-ups. 1 to 2 maintenance sessions per year may optimize results. Use exosome-friendly hair care, peptide shampoos and scalp massages help sustain growth. Protect from inflammation, avoid tight hairstyles and excessive stress. Section 5. Clinical evidence and effectiveness. A 2024 meta-analysis of 12 clinical trials involving 428 patients found that 68% experienced noticeable hair density improvement after 3 to 6 months of exosome treatment. However, 15% saw minimal changes, suggesting individual variability plays a major role. According to Dr. Michael Zhang, while exosomes show remarkable regenerative potential, the lack of standardized protocols means results vary significantly between clinics. Always verify a provider's credentials. Section 6. Possible side effects. Though generally considered low risk, some patients have reported mild scalp irritation or redness, common with microneedling. Allergic reactions, which are rare but possible if exosomes are derived from incompatible sources. Infection risk, if improper sterilization techniques are used during injections. Temporary shedding similar to PRP therapy occur where hair may thin before regrowth occurs. Section 7. Cost analysis. Umbilical cord-derived exosomes, highest potency, cost $5,000 to $10,000 per session. Adipose or bone marrow-derived exosomes cost $3,000 to $7,000 per session. Synthetic or lab-grown exosomes, cheaper but less studied, $2,000 to $4,000 per session. Section 8. Ideal candidates. Exosome therapy is not a one-size-fits-all solution. The best candidates typically include men and women with androgenetic alopecia, pattern baldness, those patients with early to moderate hair thinning, those who have not responded well to minoxidil, finasteride, or PRP, and individuals seeking a non-surgical, natural-looking restoration. Who should avoid it? Patients with active scalp infections or autoimmune disorders. Those expecting miraculous results. Managing expectations is key. And those people unwilling to commit to multiple sessions and maintenance treatments. Section 9. Final verdict. Exosome therapy is undoubtedly one of the most exciting advancements in hair loss treatment, offering non-surgical, natural, and potentially long-lasting results. However, it is not yet a guaranteed solution. Patients must weigh the promising science against the current limitations. For now, consult a board-certified esthetician, research clinics thoroughly, and stay updated on FDA guidelines before committing. I hope you liked this video. Thumbs up, and share this video. Don't forget to subscribe for more beauty trends and treatments. Stay tuned. Thanks for watching.